segment is sponsored by Bon Secours Heart and Vascular Institute.
Atrial fibrillation is the most common abnormal heart rhythm affecting millions of Americans. Joining us this morning from Bon Secours Heart and Vascular Institute is Dr. Grewal to clarify what an AFib actually is and the treatment options available. It's great to see you, Doctor.
Thank you very much for having me.
Appreciate you being back with us. This is an important topic to cover because it does impact so many people living in this country and really around the world.
It's the most common arrhythmia in the United States. Affects 5% of the patient population above the age of 60 and 10% of the patient population above the age of 80. Doctor,
are you born with this? Is this something that develops?
It's definitely not something that you're born with, something that develops as you age. There's several contributing risk factors, whether it's high blood pressure or sleep apnea, sometimes genetics, people who have lung disease, whether it's COPD or other issues, are all kind of contributing factors, as well as lifestyle issues, whether it's extra weight or smoking or alcohol. All those things kind of contribute to it.
A lot of folks watching may say, that's me that you've just described. What symptoms would they be having, or are you even going to see symptoms?
Yeah, so that's the kind of scary thing of atrial fibrillation, is that a lot of times you don't have symptoms until you actually present to the hospital with a stroke. So about 15% of strokes in the United States are associated with atrial fibrillation. And about a third of people who have atrial fibrillation will have a stroke at some point in time. So other issues, sometimes people will feel shortness of breath, sometimes they'll feel an irregular heartbeat, palpitations, sometimes they'll feel chest pain or fatigue, but there's no one common presenting symptom that people present with.
That's kind of frightening, because how do you know to be preventative about it? Is your physician screening you for this?
Well, I think oftentimes, unfortunately, people will present with a stroke, or oftentimes people will present with some of these issues, and you screen them with an EKG. So whether it's your primary care office or whether it's your cardiologist who gets that, you can get an EKG to determine that, or you can get some long-term monitoring that will determine that.
Okay. We talked about the option of treatments, and that's evolved a little bit. What's available?
Traditionally, what has been available is medicines. And so, unfortunately, medicines, no matter what medical therapy you use, there's lots of data that shows that 2 years out, only about 50% of people will still remain in normal rhythm. And so, in the last 10 years or so, we've started doing a procedure called an ablation. So we know that atrial fibrillation is an irregular heartbeat, and the irregular heartbeat is initiated by abnormal cells that grow in the top left chamber of the heart, the left atrium. And so the ablation is a procedure where we go in and we burn or freeze those extra signals away. And so as technology has improved, the chances of successful ablation have significantly improved.
So this is now on the horizon. This is here. The best candidates for this?
So the best candidates are people who, we usually like to say that people who present earlier with atrial fibrillation are the best candidates, and they have the best success with the procedure, because there's a saying that atrial fibrillation begets atrial fibrillation, and sinus rhythm or normal rhythm begets normal rhythm. So once you've been in it for too long, the chances of success decrease. So the earlier you get to your cardiologist, and the earlier your cardiologist refers you to an electrophysiologist, the better it is for the patient.
Always good advice seeking from your doctor, but earlier is better in this case.
Absolutely. Because once you get to more of a chronic state, that's when you become candidates for a new procedure that we've started doing called the hybrid ablation. And the hybrid ablation is basically, I do a tag team with the cardiothoracic surgeon, where they go in, they do an approach through the stomach, underneath the stomach, on the outside of the heart, and burn the outside of the heart on in, and then I go in from the inside and burn from the inside on out. And those are people who have chronic atrial fibrillation, who've already had ablation and it hasn't succeeded. The more kind of tougher cases are the patients that we do the hybrid ablation for.
It doesn't sound super pleasant, but the results are. Thank you for being with us.
Thank you very much.
Appreciate it. You can learn more, and for more information, call Dr. Harpreet Grewal's office, 730-1481.